Welcome to the Catalyst Effect. We are live at Austin Tech Week here in Capital Factory. I am your host, Isaac Carter, and we have been all week long talking to founders and doing our series, The Voice of the Founders, to find out who our founders are serving, what solution they're building, and kind of their why for the whole background, because we found that why people do things is a lot of times as important and impactful as what they're actually doing. And I'm here with Courtney. Courtney, tell us a little bit about yourself and your startup.
Well, I think first it's important to say that I'm not one of the founders, but I am a founding employee,
Awesome.
so to speak. A little bit about me is I started my beginnings in healthcare as a pharmacy tech, went throughout college, was a founder myself with a electronic medical record company that I launched in Nairobi, and I have found myself working here at ShiftRx.
ShiftRx, very good. Tell us about ShiftRx.
Yeah, so ShiftRx is a pharmacy marketplace.
Okay.
So what does that mean to anybody? Most likely nothing. So I think the best way to break this down is we are all familiar with Uber. And what Uber does is it connects drivers with riders at the exact moment that they need each other, right?
Okay.
Uber makes sure that that driver has car insurance, that they have a car, that they are licensed, and they're, able to drive on the road. And most importantly, they make sure that you're safe. Now, the rider doesn't pay the driver directly. The rider pays Uber. Uber collects a fee. Bada bing, bada boom. We all understand that.
Yep,
So
very similar. Airbnb,
Exactly.
Turo, all these folks.
now, how does that, relate to ShiftRx? So what ShiftRx does is we connect pharmacies with pharmacists and pharmacy techs.
Okay.
We make sure that our providers are licensed in that state, that they're in good standing, that they've passed a background check, and that they know the software. So at the point when a pharmacy needs somebody for a shift, they're able to then use our platform through our matching algorithm and hire either for that shift temporarily or full or part-time.
Okay, so kind of almost like temp work, but for certified professional for pharmacists.
Right,
Okay.
higher skilled workers.
Awesome. And are you focused exclusively on like the pharmacy techs, the pharmacists, or are you also hoping to get into more of like the generalist hospitalists at some point?
So no, right now, the company was founded by healthcare providers. We are focused on pharmacists and pharmacy techs, so we want to do that right and stand by them.
So when we did Code Launch, there was somebody that had a similar concept that they were trying to do that for, obviously not the highly skilled workers, but the fast food restaurants, retail, where you could just go in and pick up an employee for a few shifts. And the challenge that they had there was the systems for Taco Bell and McDonald's and JCPenney are so much different. The floor plans and layouts are very, very different. So it was very challenging for somebody to come in and work a shift. But pharmacies do seem, you walk into a pharmacy and they're either you walk into CVS and the pharmacy is either at the back left or back right.
Right.
The pharmacy itself seems to be pretty similarly laid out. The systems are not dramatically different. Is that kind of allowing this to kind of be more feasible for pharmacists, or is it just standardized to the point where somebody could work at Walgreens one day and Kroger Pharmacy the next?
Yeah, I'm never going to say that one size fits all in pharmacy. Definitely not.
Sure.
And that's one thing that we have really honed in on, making sure that whenever a pharmacist does apply to work a certain shift at a pharmacy, that they know what is the script count. What are the policies there for controlled substances? What is the lunch break? So before just blindly going into a Taco Bell and not knowing, are you the only one doing drive-through? Or, are you the only one that's a line cook? With us, we allow the providers to know who are they working with. Will they have a tech? Are they alone? So they know that ahead of time rather than just going in blind. So that is definitely something we saw and we then addressed.
Awesome. I went to pick up medication. My daughter had an upper respiratory infection, and so I went to Walgreens. And I went like an hour after they were supposed to open. The pharmacy was closed because the pharmacist wasn't there.
Okay.
And the pharmacist got there around 1 p.m.
Wow.
Now that they're calling the prescription in directly electronically, I don't have a piece of paper. I can't take it to a pharmacy that's open.
Right.
That pharmacy needed to be open and it wasn't. So I completely understand. I mean, they didn't have anybody scheduled to work that shift that morning.
100%. And that's, where we come in when somebody, it's not a matter of if it'll happen, it's when it happens, because people are late to work, unexpected emergencies come up, and with us, you're able to then say, oh no, I can't come in today.
Right.
You can post the shift and one of our providers will show up, and you have that trust in our product that, hey, they can work, they have used this system, and it's almost like a plug and play in the safest of ways.
So what's the motivation for the pharmacist? For me as a data scientist, data engineer, I'm not going to just like go, hey, I got 8 hours free. Why don't I just go in and work somewhere new for a few hours? So for me, that's kind of a foreign concept. But for the pharmacists themselves, I'm guessing if somebody has pharmacists, these guys are working a lot. Are there people just enough time that they're just looking to pick up shift work, or how does this work?
Yeah, I mean, it's going to differ for everybody. I apologize. It's going to differ for everybody. But when it comes down to it, it's people who want flexibility. Okay. So let's say it's a mom who is a pharmacist and she, is taking care of her kids, but she can work on Wednesdays or she can work this certain amount of time. It's somebody who wants to upskill. They are working retail, but they really want to get into sterile compounding, or maybe they really want to get into working long-term care. They can basically try before they apply full-time, and that's part of our secret sauce that we find that a lot of providers really like, because they're able to upskill in such a way that is really beneficial for their career long-term.
So my wife and I, my wife studied in the medical space, and then I started getting really large contracts, and a lot of these contracts would be 8 weeks here, 10 weeks there, and we would all go together. And so there were a lot of times where, and it was pretty consolidated in Texas, some in Florida, but most of the contracts were in Texas. And so it was really complicated for her to have like a full-time job, because I would finish a contract in Houston and go to Austin, or go up to Dallas, and we didn't want to keep the family separated, so we would stay together.
Of course.
So in that type of opportunity, we run across when we were in our travels in the RV, a lot of traveling nurses, where the nurses either they're alone and their husband comes on the weekends, or traveling physicians are taking a specific term contract, and their significant other couldn't work while they were doing that, because you're going to get a job as a pharmacist for 2 months somewhere.
Right.
So that makes a lot of sense in those scenarios, creating more opportunities for flexibility. And then also, as a contractor, I'm able to, people will pay me a slight premium, 20-25% premium, to come in and solve their need and then leave.
Right.
One of the benefits of a consultant is they leave when the job is over.
Yeah.
And so I can see that maybe a pharmacist saying, hey, you know what, I could pick up 4 shifts a week and make the same amount of money as if I was working 5 or 6.
Exactly.
Or I have some goals. I want to go to Bali for a month. Let me pick up a Saturday shift places and increase that. So that is pretty cool. What stage are you all in right now? Are you in production, live, operating?
We are live. We're live in all 50 states.
Awesome.
And just like you said, we are increasingly seeing more remote opportunities, which is, providing that flexibility. And of course, those job opportunities and those shifts are filling fast. But we're seeing more and more transition to remote pharmacy.
What does a remote pharmacist look like?
I'm sorry, what?
What does a remote pharmacist look like?
So basically, they're verifying the prescription that the doctor has,
Got it.
prescribed.
Okay, so here's the prescription. Here's the patient's other prescriptions. yes, this is good. Go ahead and do this, and then the tech fills it.
Exactly. So
Okay.
whether it's at a central fill, they're basically saying, okay, this is Donna. Donna weighs this much. This is the medication. Okay, is that, is therapeutically, is that safe? Yes, okay. Bada bing, bada boom. Fill the
Neat.
script.
Awesome. So how many pharmacists are active on your platform right now?
Yeah, so we have over 8,000 providers on our platform.
So at what stage did you enter the company? Did you come in at like concept phase, or were they up and running and active before you joined?
Yeah, so I would say when I came in, they had just launched to all 50 states. So previous to that, they had a stronghold in 5 states, being California, Florida, New Jersey, New York, and California. When I came in, it was really about, okay, how do we address the rest of the market? How do we get them to know about us? And that's not necessarily, marketing. It was really letting people know, hey, there are these job opportunities, bringing on those facilities, aka the pharmacies, so that the providers had work. So that was really the first task that I came on for.
That is really cool. I love seeing the ability to more federize work. I know a lot of people believe that the full-time job is the bedrock of the middle class, but for me, I like to be able to build my skill and then offer my services, my talent to people who will pay the most for it. And
Exactly.
that has offered me a lot of flexibility, and it's been a good experience for me going in, working somewhere for 15 years, and then pensions are largely gone at this point anyway, but
Right.
taking the retirement benefit and then moving on to something or staying somewhere until people used to call me, has you got an opportunity where you can just stay there, be stable until you retire. I'm like, oh my God, that sounds awful.
Yeah, I think that model is like long past
Yeah.
gone. And if we look at on the other flip side of this, since it is a marketplace, I think it's really important for our pharmacies that they're trying before they hire. So they're not committing to somebody without seeing that they're a fit. With our platform, they can have them come work, do basically a working interview.
Yeah.
And they don't have to have them on payroll. They don't have to go through all those like legal implications of hiring someone, finding out they're not a fit,
Yeah.
and then that process. So in a way, it definitely helps both to feel each other out.
I used to work for a medical device manufacturing company that was doing a clinical trial, and there was a very famous ophthalmologist in Pinellas County, Florida, that was doing the trial and got through 2 years, did 30% of the study, and then found out that he never had a medical license. He was implanting intraocular lenses, had done it around the world. Somebody taught him how to do it. He opened his own clinic, and now this multi-million-dollar clinical study had
Shot.
Yeah, 30% of the cases had to be redone, and there was no rebalancing it. So,
Oh, wow.
I mean, the impact, first off, especially if you're in a higher turnover type of situation, or you just need somebody fast, you don't have time to qualify their background. I mean, this guy had fooled clinical trial administrators and overseers with the FDA for like 15 years.
Wow.
A local pharmacy can't do a better job at that than that. So bringing in somebody a company such as yourself, saying we specialize in ensuring that you have the proper qualifications, training, licensing, and everything necessary to be sure that you are a qualified provider.
Correct.
Can really reduce a lot of risk, and at the end of the day, I'm not going to a pharmacy because I'm having a good day, right?
Exactly.
So anything that we can do to improve the experience for people who need care, and do it in an intelligent way, I'm all for. So I love it. That's great. What's next for you, Courtney?
In what way?
What's next? Where are you going?
I mean, I think what's next is really addressing the market of like mid-sized pharmacies. They have non-competes. They don't want pharmacists that work, at other pharmacies. And so, they have multiple chains, but they're they're still on paper. You know, there's still call outs at certain stores. And right now what happens is the PIC, so the pharmacist in charge, they'll get on the phone, they'll call store number 2, hey, is Jennifer able to work today? Oh, well, let me text her. You know, I'm not sure, but maybe Jordan from store number 7. And so it's very much manual, it's very much texting. And so I know the next portion of this is white labeling it for those mid-sized clients so they can handle their internal flow pools efficiently.
So adding internal organization capabilities to your software and having CVS Region 1 go in and set up all their pharmacies in there and handle the scheduling in that.
Yes, and then their employees can then, you know, oh, I'm willing to drive 60 miles, where Rachel might not have known that, you know, Jim was willing to do that.
Right.
You know, there's no way to keep up with what's going on in people's personal lives. We don't know who's part-time. It's very hard to know a whole organization. So what this does is really allow that transparency and enable the pharmacies. I mean, at the end of the day, we just want you to fill scripts and we'll fill the shifts.
Nice. Yeah, a lot of folks don't know that Medicare has services in a lot of rural areas. It's impossible to get actually service providers, not just pharmacists, but across the board. Mm-hmm. So there is allowance and funding for pop-up service providers or service centers. So that is medical doctors, nurse practitioners. They will go into the community center in a rural community and provide care. I know Algonac, Michigan, my dad's on the city council up there.
Okay.
Their pharmacy closed.
Oh, really?
And then the mayor actually went on a hunt and found a new pharmacist and then brought him in and opened a new pharmacy in that town. Not all small towns can do that.
Right.
So knowing that there are funds available and that there are mechanisms out there to allow for pharmacy to be open one time per week and have that covered by some funds from Medicaid. There's a lot of programs out there for flexible care providing.
100%. I mean, going back to the remote work, when we talk about Medicare and MTM being able, some pharmacies, they just don't have the time to sit and call their Medicare patients and properly counsel them. You know, having someone come work 2 hours remote to call the patients in your community to make sure that they understand how they're taking their medication. You know, these mom and pop pharmacies, like, they want to provide that care. And what we do is we give them that space to, one, you know, there is the aspect of collecting the revenue from MTM, of course, but more importantly, what is that doing for the community? Right. Having your pharmacy call you, having them, you know, hold your hand, talk about your medical experience, what are the symptoms that you're feeling? Is this the right therapeutic choice? Do we need to contact your doctor? What's the prior authorization? If so many people, you know, their insurance says, no, this isn't medically necessary. Is that up to them? Is that up to the insurance? If you ask me, no. Pharmacists, they're going to say no. But because the patient doesn't have an advocate, that's where we can come in and help provide that.
Yeah, at the beginning of my weight loss journey, I've lost about 110 pounds now.
Congratulations.
Thanks. At the beginning, I was type 2 diabetic, a whole list of diagnoses.
Right.
And I needed some support to be able to start the weight loss journey. And so I went to my doctor and they wrote me a prescription and the insurance said no. So I went to a compounding pharmacy who advocated for me and got something that I could afford to cover on my own until they got to a point where they were able to get the insurance to cover something for me. And that jump-started me, and then so I lost my first 50 pounds and then was able to handle the rest of the diet and movement and lifestyle changes. And
did you see a change in, like, your A1C, or did you a reduction of medication, like daily medications?
No medications now.
That's incredible.
Completely in remission. Yeah.
So you can really feel, like, how healthcare, you know, the presence of
that
this.
Advocating for the patient is, and my wife has had several medical events around when we were having our children and things. And I had to advocate for her. I mean, just finding a provider right now is challenging.
I know that story far too well. I have lupus, and just anything with autoimmune, you know, not one size fits all. And it's literally like
Yeah.
it's a lot.
My sister has autoimmune disease, and she has been on pain management, and her doctor was actually arrested. DEA came in and wrote a lot of, and now the pharmacists, they won't touch anybody that was there with them. She has nobody to advocate for her. This is in Georgia. So
sorry to hear that.
having that, knowing that that's kind of the direction, solving an immediate problem for the pharmacy, and then getting to a point where you're able to free up resources, apply technology, and ultimately advocate for the patient to increase the patient, the population health. That is amazing. Excited to see how you all continue doing that. How would our viewers find you?
Yeah, so the best way to find us is by going to our website, that is shiftrx.io. We're also available on the App Store, so any pharmacist, any pharmacy techs, you simply look up ShiftRx and you download the app, and it's a very easy sign-up process.
Awesome. Amazing mission, amazing company. Really excited. Thanks for being here today, Courtney. And we are live all day here at Austin Tech Week in the Capitol Factory. We are right outside of the Connector Plus Lounge here on the 5th floor. Come on by and let's talk about your startup.
Awesome.